Today, COVID-19 vaccine in focus. More than 150 vaccines in labs across the world are currently in development, including the UK, where human trials begin this week. Biotech company NatK West is one of the companies lending its expertise to fighting COVID. The company's chairman and CEO, Dr. Patrick Soon-Shiong, is joining us this weekend to discuss that and a lot more. Doctor, it's great to see you again. Thanks very much for joining us.
Thank you for having me, Mary.
So I want to talk first about your concerns about many of these companies in development for a COVID-19 vaccine. You are looking at cells and developing drugs based on these cells. Tell me the concerns that you have and why you say at this point it doesn't look like half of the country is even going to take a vaccine because of the concerns that you have.
Well, I think this is a concern that, Dr. Fauci has also voiced, and a lot of the scientists are now voicing, that every vaccine in development is going after the outside of the virus called the spike, trying to develop antibodies. And so that was the rush to start the development. Unfortunately, we soon realized that what we want to do is not only go out after the outside, the spike, we will need to go after the inside of the virus, the nucleus of the virus, and that's called the N. And to my surprise, we are the only developer of vaccines that's going after both N and spike, so that we don't have just antibodies, but we also have memory T cells. The real concern is you need to have this injection of what we call memory, so that you have long duration of protection, and the antibodies, as we begin to learn, don't last very long.
So you're looking to create more memory T cells?
Yes. So the idea is that by going after the innards, or the innards of the virus itself, you develop a T cell that when the virus tries to attack you, not just your antibodies block it, but your T cells kill it. And in order to do that, we found that you needed to go after the nucleus of the virus, not the outside of the virus only. So, to our surprise, we are the only vaccine, as I now understand, even in the world, because I've looked high and low, to see if anybody else is going after what we call the nucleus N protein and the outside, the S protein. And we've devised a way where we put both N and S into the adenovirus little vector and inject that. So we are now ready to go into clinical trials, and I'm really hopeful that our government will support my being able to develop billions of doses. We're one of the companies that have applied to BARDA, and we're hopeful that they will be responsive so that I could have enough of these finished dosage forms for the nation.
So what has been the response so far?
Well, I've had some communications with senior officials at the administration, and unfortunately, they've made the choices of the 5, and we just are waiting the results from BARDA, and I think we've been informed that we should wait until we go through that process. Having said that, it is disconcerting for me that every of the 130 developers in the world all going after the outside of the virus called the spike. That spike mutates. We know that. More importantly, that spike generates antibodies and very little T cells. However, when you add the nucleus to the spike, you have both T cells and antibodies. And I think it's really important that that novel construct be tested. There's no guarantee, obviously, that our construct will also give you long duration. But at least we now know that patients who had SARS-CoV in 2003, 17 years later, were protected with the memory T cells, but only to the nucleus. So there's now papers showing that 24 out of 24 patients that were tested had these memory T cells to the N, not to S, but to the N. So it was so important that, your show where it becomes known that there's an alternative just to antibodies alone.
And this is really an innovative clinical stage immunotherapy. I mean, this activated NK cell platform is also designed to destroy cancer and virally infected cells. Tell me about the broad range of uses that you are expecting if, in fact, you were to come up with this vaccine.
Well, what's exciting is that the vaccine I'm developing for COVID originated out of my work in cancer. We've used the same vector in 125 patients in 13 phase 1/2 trials now, including trials with the National Cancer Institute. So the concept is not only do we activate your T cells, which are the killer cells, we in cancer also activate your natural killer cell. And we now have, as you presented with Senator Reid, complete remission with metastatic pancreatic cancer. We've also seen complete remissions for triple-negative breast cancer. We've also seen complete remissions for head and neck cancer. So what's exciting, this is a universal treatment of your body against cancer and infectious diseases. So our company has really positioned itself to address your immune system.
I love this. So, Dr. Xiang, do you think we're going to see a vaccine for COVID-19 by the end of the year?
Well, you will see dosage forms. I mean, look, I think Moderna and et cetera, they're all developing. And again, my concern is they're all developing against the outside of the virus, not the inside of the virus. You need to kill this virus from the inside out as well as from the outside in, or block it. So the spike from the outside in is antibodies. Antibodies may not last long. On the inside, the innards, the nucleus of the virus, you can maybe generate T cells. So why would you not then put both together? And that's what we're the only ones are all doing that. So the answer is yes. You'll probably have dosage forms. You'll have phase 3 clinical trials. I'm hopeful that we could enter into those phase 3 clinical trials. It will be one of the Warp Speed or the active program, but we've not been invited at this stage.
Wow, very fascinating. Let's take a short break. We've got a lot more with Patrick Soon-Shiong when we come right back. Sir, stay with us. We'll be right back.